My father was a physician in South Georgia, Brunswick, and we had a little farm up the coast in Darien, on the ridge. And on Wednesdays and Saturdays, when Daddy would go up to plow his little farm, there would be a lineup of people where the caretaker had said Dr. Joe is coming. And I got to play his nurse, and he provided the only medical care that was available at that time in McIntosh County. When he died, and then I went on to nursing school, I joined the Navy so I could see the world. And when I retired, I came home to Georgia, and I was doing some volunteer work through my church, and it ended up coming over here to volunteer as well as at Our Daily Bread, which is a local soup kitchen. And 2 years ago, when they did some restructuring, the board asked if I would consider taking over as the director, and so I did. My name is Paige Mercer Cummings, and I am the director of the Athens Nurses Clinic here in Athens, Georgia. Before I started volunteering here, I had never really worked with this population. I thought I had, but I really hadn't. It requires a certain change in your own mindset, because you have to go from thinking, well, why aren't they following their dietary rules? They're diabetic. Why aren't they following their rules? Or hypertensive. They're supposed to be eating this kind of thing and doing this kind of thing. Well, when you have no money, it's hard to eat good. We have to change our mindset. I remember when I was a student and somebody said, well, you know, soap is cheap. Why can't they at least be clean? Well, we have people who don't have a place to go to bathe. And soap may be cheap, but cold water is not comfortable when it's cold in Athens.
I've never worked in an indigent clinic, so this is like an eye-opening experience for me. And I've always told myself that if someday that I wanted to open a clinic like this, I wouldn't know how to do it because of my experiences here and because of working with Paige. She is, sometimes people, like, we don't realize how much she does because she does a lot of it in the background. Like, we'll be, like, you know, busy with doing stuff and with the charts and the patients, but you know, she's the one out there shaking hands with people and getting our name out there so we can get increased funding, increased exposure.
I go to Athens Area Homeless Coalition meetings every month. I go to the Arch Foundation meetings every month. That's the Athens Resource Center for the Homeless. I speak at churches. We gather supplies from places that donated, and sometimes we have so much we reposition it to other places again. And pass this on to MedShare, and MedShare is an organization in Atlanta that will come and pick it up and then put it out to other agencies.
She's just a very, very busy person. I don't understand how she runs the clinic, and then she has about 2 or 3 meetings a day afterwards, because the clinic is a free clinic and you have to go find money. So Paige has to go to meetings, have to go to conference, has to go find money, and it's a 2 or 3 person job, in my opinion. She works 14, 15 hours a day.
I didn't really want to come back to work full time, and this is supposed to be part-time, but it's really more like 60 hours a week. But I wouldn't turn it down. You have such a good feeling when you've helped somebody. And when I worked for the Red Cross and we drew blood and we knew it was helping somebody, that was good, but it's a different feeling. Here you are one-on-one making a change in somebody's healthcare status. And you can't leave without a better feeling than that you have made a change in somebody's life.